Hey everyone, my name is Cheyenne Davis, and I will be presenting about a child life specialist. That was the career I was interested in. So, child life specialists tend to work in hospitals. A lot of them work in hospitals. I think some work, in other places too, but the child life specialist I spoke with works at East Idaho Regional Medical Center, or ERMAC was what they all called it. And they only employ one, but most child life specialists will work, well, a lot of them work at like child hospitals like Seattle Children's Hospital and that type of thing. Um, I talked to a lady named Diana. So the working environment for child life specialists, outside, they work in a lot, most of them work in inpatient facilities like hospitals. For Diana, she said, her schedule kind of varies. She said she normally gets in at 6, but depending on what's going on, she might stay later. Because what a child life specialist kind of does is kind of helps children deal with the stressors and anxiety of being in a hospital or being sick, or if their parents are, you know, going through something, then the child life specialist will help with that. And they'll, like do kind of recreational therapy with them, doing crafts or playing games, and telling them about procedures, helping them know what's going on. So that's why a lot of them work in hospitals. Um, as far, she said that, being a child life specialist can be both part and full time. Diana also said that as far as being family friendly, she said it's not very family friendly at first. She would think just because it's pretty competitive, and from my research online, it seems like there's more child life specialists than there are jobs available. So a lot of it's kind of, you can't just expect to find a job near you, especially like if you live in Rexburg and you want to go nearby. There's only one child life specialist that is employed at, Eastern Idaho Regional Medical Center. So you might have to go further, which might be hard if you have a family. But I think outside of that, it probably, like once you have a job, it probably is pretty family friendly. So typical stressors, something that I thought was interesting that Diana said that is something that isn't necessarily like super stressful, but kind of hard for her sometimes, is that she has to advocate her position with people in the staff, like and the hospital staff. If someone doesn't know what she does, then they kind of write her off almost. Like she has to tell them, no, like this is what I do and this is why you need me, and so that she can do her job. Because she said, like in the pediatric unit, a lot of people know what she does and they know that she's important, but outside of the hospital, if she doesn't work with people very much or they don't know her, then that can be hard. And then outside of that, you're dealing with sick kids, and if a child dies, you talk to their parents about it, or their siblings about it, and if a parent dies, then you talk to the kid. So kind of like similar with like being a doctor or nurse, like giving people bad news can be hard, and the child life specialist helps kids to understand and cope with what's going on. And she said that it can be hard to leave work at work sometimes. Typical benefits, you know, she said that like the normal stuff like insurance, retirement, all like things that you'll find at normal jobs, especially if you're working full time. I think it might be different for part time. Common job tasks. So what I found and what Diana said is, helping kids cope with anxieties about being in a hospital. She said basically being a kid translator for what's going on, like helping them understand, the procedure, or, someone died or whatever. She helps prepare kids for surgeries and procedures. She also will take molds of hands and feet of children and do their handprints, and kind of helps educate parents and siblings about what's going on, and being like helping the interaction between patients and the hospital staff. So education requirements for a child life specialist, currently they just need a bachelor's degree in like child life, child psychology, marriage and family studies, child development, recreational therapy, any of that, something that's related. Toward needing a master's degree, but currently you don't need one. I think in like the 2020s, you're supposed to, like, that's when it's like for sure you're gonna need a master's degree. And you do have to be certified. You have to get your CCLS, which is Certified Child Life Specialist certification, and that you have to have a bachelor's degree to get that, and have coursework in child life or a related topic, and complete 480 hours of clinical work and pass the exam. And I think that has to be unpaid. So the starting salary range for child life specialists is around $39,000-$40,000, it seems. The lowest Diana said she saw was $14 an hour, which is pretty low. And if you're doing that for full time, I did the math, it would be about $30,000 a year. For a more experienced range, for like 9+ year, it's around $50,000. So some other information that Diana said, she said that volunteering is really important because you have to get an internship and they're pretty competitive. So she said, like, for her, volunteering in a hospital and having lots of experience with kids was really, really important to make her competitive for getting an internship. She said, for like in this area, ERMAC doesn't offer internships, so you might have to go to like Boise, and you might have to, be willing to travel if you want to do that to get a good internship, or go to a children's hospital, or whatever. So you kind of have to be committed to it, because it's not just a place where you can get a job anywhere or that has a lot of jobs. But I think it sounds like a really cool career, and that's pretty much all the information I have.